So I was recently hospitalized after a serious adverse event to a clinical trial study drug, and I had to be admitted to hospital. And I was basically presenting with severe dizziness, severe chest pain, trouble breathing, severe headache. It just felt like my organs were getting squeezed really, really tightly. And when I admitted, I had some blood drawn and I saw the doctor briefly. And my results came back showing severely low electrolytes as well as low protein levels. And so they started giving me intravenous magnesium, potassium, calcium. And I stayed overnight for observation and was discharged the next day. But I realized that the quality of care I got at this particular hospital was leagues above that I've received at any other hospital, simply because it is in a wealthier part of town. And I ended up accidentally going to that hospital when I selected the wrong one because it shared the same city name. Normally, I go to a hospital that's a lot closer to my home, but they have a long history of psychologizing my symptoms. They generally do not test for magnesium separately because magnesium is an electrolyte that's not included on the comprehensive metabolic panel, so they tend not to order it separately. So if I had gone to that hospital, that test would not have been ordered. I probably would not have gotten IV magnesium, which is really critical because if you have low magnesium, potassium, and calcium, you need to replenish the magnesium first, because once magnesium drops, that also causes drops in potassium and calcium. So if all three are low, you need to replenish the magnesium first, because as long as that one is low, the other two will also follow suit. But I'm basically just flabbergasted at how different my treatment has been depending on the zip code that the hospital is located in. And it just blows my mind that so many of us are just falling through the cracks because we live on the wrong side of the tracks, essentially. And I just feel like something's got to give. Something's got to give. I think in a lot of areas that are not well off, because of socioeconomic status being lower, health outcomes tend to be poorer. And that leads to overcrowding in hospitals. The staff, doctors, nurses, lab tech are overworked. So that leads to less efficient, less empathetic patient care, and that leads to worse outcomes for the patients. Because in this particular hospital that I went to this most recent trip, the foot traffic was a lot less. Socioeconomic status of the people who were there was a lot higher. I felt that the nurses were not as stressed, which probably made a big difference. I just don't know what the answer to these solutions is, because America is one of those countries where you do have to be a top earner in order to have health that is equivalent to the bottom quartile in Europe. So it really is pay to play in America, unfortunately. And I think that I'm seeing a lot of that firsthand as a patient. They had compared hospitals in Manhattan versus Queens and the health outcomes of those respective hospitals when it came to things like COVID. And the Manhattan hospitals, their patients fared so much better. So again, I don't know what the answers are, but there's just a very stark difference depending on the hospital that you go to and the clientele that frequent it.